Welcome everybody to our third installment of interviewing our members. Today I have the pleasure of introducing Lauren Thompson. Lauren is the partner of Cara and from Thompson and Hoffman Audiology in Durban. And I'm proud to introduce Lauren. We have been in private practice for 11 years, but a lot of people don't know Lauren, and I wanted to talk about her passions today and what makes her a passionate, ethical, professional, independent audiologist and part of our team and part of the APPF team. So welcome, Lauren.
Thank you so much. Thank you for having me.
Such a pleasure. So Lauren, as I know, but most of you won't know, is very, very passionate about vestibular assessment and rehabilitation. So in the past, I know that Lauren used to do a lot of ENGs, and it's now moved over to VNGs. And in the beginning, it was a lot of water, calorics and irrigation. No. Yes.
No, I never used water. I've always used air, but yeah.
Okay, so tell us first of all, what makes you passionate about the vestibular patient?
Yeah, thank you. I love vestibular. I always describe it to my patients like a big puzzle with so many different pieces that you have to look at in order to come up with a diagnosis, so to speak. It is never clear cut. Sometimes it is, and those are the great cases. But it's looking at a patient in a whole and working with lots of other colleagues to try and help this person who most often has had this problem for years. I see dizzy patients probably three or four a week. And the amount of times they've said to us, I always start by saying, tell me from the beginning. And often I am horrified. And then it often goes back 20 years, 10 years. And these poor people have been pushed from pillar to post. And I think it's because a lot of people aren't comfortable with vestibular work. And then so the patient gets lost. So yeah, I love it. I love trying to help them, even just to acknowledge them, even to acknowledge what they're going through or what they've been through. I find it very rewarding. Yeah. I started vestibular when I started just out of ComServe at a very well-established practice. And that's when I just started watching VNGs. I just sat for, I think, a year, just watching how to, in those days it was ENG, so it was electrodes and gel and all sorts of things, until I finally got the confidence to actually do it myself. But yeah, things have changed dramatically, as we all know, in the field of audiology. But it's just so exciting how we can figure out more and try and assess different parts of the vestibular system. Yeah, it's just, I love it.
Lauren, so good to meet you.
Yes,
and
you.
I wanted to know, I love vestibular work. I absolutely love it. It's a very, very interesting field. And I want to know from you, obviously, you mentioned look at the person holistically. What's the sort of multidisciplinary team that you usually work with? When you see a typical person. And then secondly, what I want to ask you is, I only have the luxury of doing bedside examinations, and that's always a very strange description to say to somebody, I'm doing bedside examinations. But with your VNGs, do you find that sometimes you just do a brief screening, or do you immediately go for a comprehensive evaluation?
Thank you, Sabrant. So to go back to the first part of your question, I work a lot with ENTs, mainly. Those are my main referrals. Try not to get into trouble. I don't feel there are enough referrals, put it that way. I feel I should be hearing from a lot more general practitioners. I should be hearing from a lot more neurologists, even pediatricians. But my main source is, my main team is the ENT and then the vestibular rehabilitation physiotherapist, who often sort of takes over from me when I feel that I've done as much as I can within the realm of my scope and time. So yeah, those are my team players that I liaise with. I mean, but I've also worked with chiropractors and all sorts of people, because patients obviously have seen so many people to try and get answers. What the second part of the question, bedside exam. I always do the bedside exam before I start my VNG, because it gives me a lot of different information, and maybe not the full bedside exam that you maybe do, but I do a lot of that before I even start, because like I said to you, you are basically filling in a big puzzle, and something you always, like everything in audiology, everything has to match and everything has to correlate. So if you're seeing a positive head thrust in the right and nothing else, why is that? Maybe you need to repeat a certain test. Maybe it's a false positive. Or if you're coming up with a lot of neurological signs on your VNG, but everything looks totally fine and nothing in the history, well, then maybe you've got to go and repeat those tests. Maybe the patient wasn't concentrating. So yeah, I spend a lot of time with them. I mean, yeah, I think there's probably going to be a question later on, but history is the most important thing. And I can't stress that enough to all the audiologists out there, even who don't have any VNG equipment or V-hits or anything. Taking a good, thorough history, you can start to visualize and put things into boxes and start to see where, the path is leading you in your thoughts. So yeah, a huge, huge emphasis on history. Then I do my bedside exams. They think I'm crazy that I get them marching all over the show, and but and then I start with the VNG. So it is quite a process.
I wanted to ask, how much has VNG changed, and the assessment and management of the dizzy patient from the time that you started and you qualified to what you're doing now? Are you doing the same? Or are you doing more? Are you doing things differently?
Thanks, Cara. A lot of the things fundamentally are the same. I think obviously with the research and with the more lectures you attend and the more courses you attend, you learn different tricks, I would say, different techniques that you feel are more adapted to you or suit you, or that you prefer, like repositionings, all those types of things. Those things have changed. And the ENG, I didn't even do one at varsity. So that the technology has changed. The V-hits, the equipment and the accessibility to different things has changed quite a bit. So yeah, it's a constantly evolving area. Unfortunately, you do need to have the equipment to fully create a full clinic, which I think turns people off quite a bit. But then you can still have a special interest, like Sabrunt, and still do all the bedside exams and know who to refer to.
When you started to what you're doing now, I know that I don't remember when you started and when we were together at employed in another practice. I don't remember you doing things like gait assessment, but I might be wrong. And I don't remember you doing things like repositioning or vestibular rehabilitation.
That was a long time ago. And in that environment, I think it was very much with regards to repositioning. It was very much back into the ENT's domain, or you referred back to the specialist. Now I'm finding that a lot of the ENTs will just say to me, Lauren, if you see the BPPV, just do it. Don't delay. And then, it's just a waste of people's time and money. But I think in that sort of more, we're talking about, not to give our age away, but like 16, 17 years ago, it was very much more referred back. So now, yes, there's a lot more flexibility with regards to, fine, I'm going to manage this patient on my own. Obviously, you've got to develop that relationship with the ENT for them to trust you, because you don't want to do a repositioning and not know what you're doing. That's dangerous as well. But the rehab side is amazing. There's so much happening in the field, great equipment available, and really not expensive to set up. You can really get yourself a great little rehab clinic going, and you don't have to have a huge posturography machine. You don't have to do that. You can actually, I was chatting to a young audiologist the other day. She's far. I referred a patient back to her, and she was just saying she would love to do the rehab for her. And I said, do it. Come here, learn from me, and go back. And then you can start and you can carry on. So you don't need all that fancy equipment to set up a rehab type of clinic. And there's so many different things that you can do. So yeah, that has changed a lot over time.
So I wanted to ask, what type of patient do you see that will benefit from vestibular rehab?
Thanks. So a lot of the time, all of those unilateral weaknesses, vestibular laryngitis, obviously BPPV is great. I often find, and this is just doing this for so long, I often find that I see BPPVs later on. So say, for example, a patient has had a neuronitis or labyrinthitis 10 years ago. I often find that same ear is definitely affected by BPPV later on, and it almost just causes a decompensation. So those patients are a little bit tricky because you first have to manage the BPPV, and then you have to now get them back to being compensated. So yeah, it's usually those unilateral weaknesses. Manias, I think, as we all know, they don't benefit that well from rehab due to the nature of the disease and the fluctuations. However, you can try. If a patient's really battling and they really need, sometimes it's a lot of it's more the emotional support and the acknowledgement, but I wouldn't. Once they're stable, I would say that it would be a bit of a waste of money. But yeah, definitely the elderly. They need the rehab more than we realize because of the risk of falls. And that, I feel, is also not stressed enough in our we have a huge elderly population that we deal with, and we look at their hearing, not, audiologists, I'm saying. We look at their hearing alone. And they say, oh, I get dizzy. And then we're too busy taking a history and doing a hearing test. But we don't go, okay, well, just tell me a little bit more about your dizziness, Mrs. X, because that can actually lead to quite a massive event in their life. If they fall and break a leg or a hip, there's an incredible amount of research to show that there's a definite decline in general health after that. So yeah, I think just to be, there are a lot of people that qualify for rehab. There are some neurological patients that could benefit with more compensatory techniques. But yeah, there's a lot of scope.
Lauren, okay, so if somebody from the public is watching now and they experience vertigo or dizziness, or they know of somebody that experiences that, when's the right time to come and see you? If you can maybe give some guidance and maybe explain what vertigo is. Yeah, when is the right time to come and see you?
Sure. So if you are experienced, I think, so first of all, to determine the difference between dizziness and vertigo, people often describe it differently. And if you speak to anybody, usually they've experienced vertigo or dizziness. So it is a tricky one. Vertigo is the rotationary sensation. So the room is spinning, usually associated with nausea, vomiting. Dizziness people usually describe as sort of a lightheaded, floaty feeling, swimmy head, that type of thing. I feel if somebody is experiencing any of these things, they should definitely be consulting someone. It could be their blood pressure, it could be sugar, it could be, anything. What I often hear is, I've been diagnosed with vertigo. So I just would like the public to know, if anyone's watching, that that's not a diagnosis, that's a symptom. So if someone's diagnosed you with vertigo, we have to figure out why. What is the cause of that vertigo? And that's definitely when I would say to consult with an audiologist. Yeah, there are lots of different causes. I'm not going to go into that, but more than likely there's an audiologist or ENT or a group of healthcare practitioners that can help you and assist you in how, and to try and get your life back to feeling normal again. Because that's what happens. Usually people describe it that they're just not themselves. They're not 100%, no matter how long, no matter what they do, take medications, everything. They just are not themselves. So I think contact an audiologist or your ENT to try and get to the bottom of it.
And what type of questions should a person from the public be asking when they phone an independent audiologist? So, because as we know, not every audiologist offers the same services. And so the public needs to also understand that an audiologist is not the same as an audiologist is not the same as an audiologist. So what would you advise a patient who is battling with, shall we call it disequilibrium, the feeling or sensation of imbalance, whether it's a spinning sensation or feeling lightheaded, or sometimes the terminology doesn't match, or the patient doesn't know the correct terminology, and they phone in and they say, I'm lightheaded, or they phone in and they say that I've got vertigo. But as we know, some audiologists don't offer vestibular assessment or rehabilitation. And so it's important for the public to understand that they should be asking the right questions when they make a phone call or when they're looking for an audiologist. So for example, the public could go to our independent audiologist's website and have a look and see which audiologists are offering vestibular assessment. But just a request from you as to what you would tell the public to ask when they're phoning either for an appointment or asking for advice.
I would suggest that when they do make an appointment or when they phone an independent audiologist, just to ask, do you do balance assessments? That's the easiest, simple way. The minute we start getting into vestibular, hard things to say, it gets confusing. So I think when you're making an appointment with someone, ask, does the audiologist do a balance assessment? Like I said before, a lot of practitioners don't. So probably 8 times out of 10, an audiologist who doesn't see vestibular patients will see a dizzy patient. And it's also up to the audiologist to refer on. Sometimes, like I said, you get so focused on the hearing, and then we don't remember to, oh, okay, well, actually, your main concern was a vestibular complaint. So I'm going to refer you to someone I know that does it. So I think if the public are going to call, ask for an audiologist who does balance assessments, and then also to remember that if you do see an audiologist and who doesn't do balance assessments, then to ask them to refer you to somebody. Let them do the hearing test and then ask the audiologist to then refer you to someone to further investigate any vestibular problems you might be having.
And I have another question, because we often see patients that come in that have maybe been under the management of their house doctor or GP, and they've been taking Circ or Stugeron or seasickness medication for years and years, and they come in and they've maybe come for a hearing test and tell you by the by that they're on this medication. Is that something that should be long-term, or do you recommend that this patient should then be managed and assessed properly by an ENT and or an audiologist, and then so that would be my question to you.
Yeah, that's a great question, Cara. Absolutely. I think if you're taking a history and you've heard that your patient's been on Circ for 20 years, that should definitely ring some alarm bells. It is not meant for long-term use, and if you are using it for a specific reason, sometimes it's really high doses, which in the cases of a majority of people, it's 1 a day. It is very expensive, Circ. And yeah, we just want to prevent people from taking medication unnecessarily and actually not getting to the root of the problem. So yes, I would 100% agree with you. Get them to contact an ENT and basically start the process of trying to find out what is going on with their vestibular system. Yeah, from scratch.
Are there any recommendations that you tell patients that they have to be aware of before they come in for the assessment?
Yeah, so very important things. I mean, I think all the vestibular audiologists out there will always remember, if you are going to see a balance for a balance assessment, not to have any medication. If you've been prescribed medication from your doctor, Circ or Cinnarizine or Sibelium or anything like that, to not be on the dizzy medication for 3 days. You can take all the other medication, please. Don't stop any antidepressants. Don't stop any heart meds or blood pressure medication. It's very important to remember that. And ladies, to not wear eye makeup. I don't starve people before I see them. But other audiologists might have a preference for people not to eat. I'm quite okay with people eating and having a full stomach. It's not the end of my world. Yeah, and no alcohol the night before. That's important as well.
And apart from the dizzy patient, what else are you passionate about as an independent audiologist, Lauren Thompson?
I love audiology. I love people, and I think that's why I went into the profession, to work with people in general. I love. We are very lucky that we have a great pediatric population here. So I've literally watched people grow before my eyes, seen little babies being diagnosed at 6 months, and now they are 16, and it's amazing, and to see their progress is just unbelievable. I think it's to journey with people. That's my passion, and to be a part of that journey in a positive way, to be a positive effect on someone's life is a great feeling, and I love that aspect of audiology. Yeah, I love everything about it.
That's really, really special, Lauren, hearing you say that as well, journeying with people. That's really nice. I like that. And I want to know from you, what is it like working with Cara?
It's great. Oh no, it's so much fun. We literally have the most fun. Yeah, it's like family. You come to work, and it's you back in your different family. So we honestly have a very great working relationship, and most of all, every day is a fun, great day. Yeah, it's a privilege to work with her.
I'll pay you later. It's an absolute pleasure working with Lauren. I must say, her patients are her patients. That's definitely what I can say about that, is that those people that see Lauren, they only want to see Lauren. They don't want to see anyone else. And so that speaks volumes for the way that Lauren is able to connect with people. And especially while doing a VNG, I often I hear Lauren talking like a hind leg of a donkey, really, about any topic. So as Lauren will explain, and I'll ask you more about it because I don't know too much about it, but I know that you try and get them to have a conversation so that they're not focusing on either fixating their eyes or compensating. So I've been quite fascinated at the things that Lauren comes up with to be able to have a running conversation with someone for that full hour and a half time while she's assessing their balance. So maybe tell us a little bit more about that.
First of all, patient or person is coming, and it's a very stressful situation for them. It's usually, if they have had terrible bouts of vertigo where it's induced vomiting and nausea, and the ENT or whoever's referred them here usually tells them, oh, you be careful, you might feel dizzy. So they're quite anxious. And also, like I said to you before, people come after going to so many professionals, neurologists, X, Y, and Z, and no one can find a problem. No one can find a physical problem. So they are anxious and a bit disheartened when they get here. And I find it's just my technique is to talk and to make them feel at ease, and to relax, because if they are not going to cooperate well during the test, and they're going to be very highly strung. I'm putting goggles on their eyes and making them look at lights, and you have to try and break through to get that patient to trust you and to trust that they're not going to have another big attack. And if they do feel dizzy, that's okay. So I think my technique is to talk. A lot of the textbooks and everything and the courses, certain parts of the test you need to distract them to prevent them from fixating unintentionally. So some people get them to count backwards and say the alphabet backwards. I used to do this, but I also realized that it makes people so stressed out. If someone had to ask me to count in or miss every other letter in the alphabet, starting with it, I would freeze up and panic. So I just find talking and getting them to talk, asking them about their grandchildren, asking them about this one who lives here, and by the end of it, they don't even know, it's been a pleasant hour and a half, not a traumatic hour and a half. But yeah, you do need to do some distracting, but everyone's got their own ways.
It's amazing. It is quite a talent and it's quite an art, but that's that I suppose we're in the business of communication, and so it's right up your alley. Lauren, what equipment do you have and use to assess balance?
So, like I said before, we have all the bedside equipment, the eye charts, the subjective, visual, vertical, the bucket, which is so easy to do and make. I've got a VNG Otometrics system, and then I also do the ECOGs and VEBs. Create quite a nice full test battery for vestibular management.
Have you had some positive outcomes from the rehab that you do?
Yes, I've had great outcomes. The repositionings and BPPV is my favorite because it's so quick and easy most of the time. But it can really change people's lives. I've had people phone me the next day and say, Lauren, I can't believe it. But then I've had other people who it takes longer. But yes, to give people that confidence back is great. It's great for them. Obviously, the more intensive rehabilitation takes longer. And it's also to realize that, people are going to have good days and bad days, but we want there to be more good days than bad days. So it's just people need to, the public need to be aware that it's a long process. It's not a quick fix. If you've had a vestibular problem for many, many years, other than a BPPV, it might take a while to get back to feeling yourself.
I think it's just amazing. And for those audiologists who are newer or younger in practice or just coming out of community service that are interested in doing vestibular assessments and management, would you recommend that they spend a percentage of their time observing for a while? Or would you think that having the training just from the company that they're buying the product from would be sufficient? Do you recommend a certain period of time, perhaps of practice or falling under someone? And would you be able to offer that to, for example, to our members who are wanting to have that guidance and support?
Yes, of course. I'd always be willing to help anybody who would like to watch and learn. I think that is gold standard, to watch an experienced audiologist perform the tests and just to learn from them. That's how I learned. So I feel that it was invaluable. However, I know that's not realistic. It's not the case in South Africa because of our lack of A, equipment, and B, people that do specialize in vestibular work. So I would say if they can attend courses, they're amazing online courses. Busy with one from Richard Gans overseas. It's online. You can do it yourself in your own time, just to try and get experience and to try and learn from other people and to make connections. If you don't know, pick up the phone and ask. It's also learning to ask for help and assistance anywhere. So yeah, I think if you're a new audiologist and you have a passion for it, start small. Start by perfecting the bedside examination, because a lot of the time you can do a lot with that, and you can then advise the ENT. If you're out doing community service and things like that, no one is, I don't think, is doing that enough. So I think to start there and start your experience there and working with an ENT who might have a passion for vestibular, I think it's a great place to start. You don't need the equipment for that. And then also learning the case history, those types of things. And yeah, I'm always available to help.
So maybe what I'll ask you is, are you willing to share perhaps a case history template that you use in your practice with either our members or the people that are interested in beginning, at least starting with informal and bedside vestibular assessment? And if so, there will be a link on our professionals website for those members who would like to be able to have those resources and download them. So I just wanted to ask if that would be okay.
Yes, absolutely.
Sabra, do you have any other questions that you want to shoot at Lauren?
Lauren, I do want to know, I saw in one of the previous discussions we had with Janine, we spoke about over-the-counter hearing aids and changes in the audiological landscape and so forth. And Oliver von Borstel, shout out to him if he's watching this, he commented and said that, no, embrace the changes in audiology. It's going to make the industry stronger. What makes you excited in audiology? What makes you excited as an independent audiologist and for the future of audiology?
This platform, this group makes me excited. APPF makes me excited because I think for many of us, we have felt quite lost, not represented in our private capacity. And I think it gives us, it's promoting us and it's promoting our profession in such a great way. One of my pet peeves is us cheapening our profession. I can't cope with that because we've studied so hard, we've invested so much in our equipment and our practices and our time. And to cheapen our profession cheapens our service provision, and I don't believe that. So APPF, that's what I'm proud of at the moment, because I think it's just really forcing a way ahead in South Africa to educate the public about what is possibly the right way to do things when you want to get your hearing seen to. So yeah, I think that's what excites me at the moment, that we've got a group of like-minded, independent, strong audiologists that are banding together and supporting each other. I think that is what we've needed for a long time.
I have one question to ask you, and you can think about it. Do you have any audiology hacks that you want to share?
Just be aware all the time. The minute the patient gets up, sorry, I'm going back to vestibular assessments. Always be aware from the minute you meet that patient, what they're wearing, what type of shoes are they wearing? Are they coming to you with high heels? And then they sit down and they tell you that they can barely walk to the kitchen all the time, and it's constant. You've got to constantly be looking at how they move in your practice, even when you follow them out. Obviously, if they are very unstable, you're going to support them, but just be aware of things like that, because we need to put everything in level playing fields and say, well, okay, well, Mrs. Smith, you say you can't walk so well. Let's not wear stilettos when you come and see me. You know what I'm trying to say? So look at just subtle things, or and you can do it with patients coming for a hearing test, and then they suddenly get in the booth and they can't hear at 120 decibels, but they were talking to you from behind you while you're walking with them. So just to be aware the minute you meet that patient, that initial impression, and just to be assessing all the time. Is the patient holding onto the walls? Is she falling all over the place? Is it just a subtle stumble? You know, just to be aware.
It's a great tip. It's a great tip. So that the time you spend with the patient is not from the time that they sit down in the office, but from the time that they even come in or make their appointment, that you are aware of their situation, the way that they're dressed, and the way that they behave, and does it match up? And I'm sure that you do get a number of disability claims and like the life cover or dreaded diseases claims, and perhaps people that are over exaggerating their difficulties. So it's also just reiterates how we need to be aware of all areas related to patient well-being and health. I certainly learned a lot about vestibular work and the dizzy patient today. So thank you so much, Lauren, for your time. I mean,
thank you.
I have my time all the time. And it was an absolute pleasure to chat to you today. I could listen to you for ages because I can feel and sense your passion for the dizzy patient. So it's made you an individual and a person and someone that's real. And so I would like to also just reiterate that if you're a person in Durban and you are battling with vestibular symptoms, whether it's imbalance, disturbance, or dizziness or vertigo, that Lauren is an independent audiologist that is passionate about that very same symptom that you're experiencing, and you're most welcome to contact her.